Alsjeblieft from Amsterdam. This is Bruce Jansen with Cardiology News on the last day of a really great ESC convention. Hats off to the organizers for thinking outside the box, and I've seen things organizationally here that I haven't seen at any other meeting. It's sort of reflective of the spirit of Amsterdam. For one thing, the organizers arranged for thousands of discounted rental bikes so that attendees could cycle in the 5 miles or so from their hotels in the heart of town, mingling with the ferocious and aggressive local bike traffic. And those that made it here intact, you could tell, had a sense of accomplishment. They also they had an innovative program called Meet the Legends. They selected 4 legends of cardiology, one of whom is an American, Bernard Gersh from the Mayo Clinic. And they all had an afternoon where they would talk about their work. They would answer questions that had been emailed in. The opportunity arose ever since the meeting program was published. And then there was also the chance just to kibitz with them and shake their hand. They also had a sort of theater in the round format with speakers speaking to a circular audience in an open space with triangular high-def screens above them. For me, one of the real pleasures of a meeting like this is there's so many simultaneous sessions that I can be in a good session that is small enough that I can look around the room and see that I'm the only reporter. So this is something that I'm going to be the only person writing about. And there were a couple things that I'd like to share that left an impression on me from those kind of sessions. One was Dr. Usman Khalid of the University of Copenhagen did one of those great Danish registry studies where he looked at the entire population of the nation of Denmark in different ways and showed that psoriasis appears to be a significant risk factor for heart failure. In the past, in other studies, they've shown that it is associated with increased cardiovascular risk factors, but this is the first time heart failure had been looked at. And I think what that means is that cardiologists can over time expect, as word of this gets out to dermatologists and primary care physicians who have psoriasis patients, cardiologists are going to see more referrals for workups for possible heart failure when a psoriasis patient says, I'm having shortness of breath or one of the other potential hallmark symptoms. And the other study that I'm thinking of is presented by Dr. Jeremy Palkin of McMaster University in Canada, and he presented a randomized study, 100 patients, looking at the problem of aspirin loss of responsiveness after CABG surgery. It's a significant problem, and it can promote graft failure. Patients were randomized to different doses, and the standard 81 milligrams once a day was the least protective. 325 milligrams once a day was better, but by far the best was 81 milligrams 4 times a day. That basically just abolished the problem, and that's really kind of impractical to ask patients to do, but now they're going to be moving forward and studying twice daily dosing, which would probably have a better adherence rate. So these are both young cardiologists, and they both won Best in Show awards for their studies. So that's it from Amsterdam. Next year's meeting will be in Barcelona. This is Bruce Jansen. Goodbye.